Hey, I'm George Che-Chen, and I'm here visiting my great friend Kartik Anand at Pacific Pain and Wellness, and he's got something really cool that I've always wanted to check out. I remember doing research on this when I was back in UC San Diego, and I loved the idea of it, but I never got a chance to test drive it. So check this out. He's got this fryer here, this MaxStim, and young lady, this beautiful young lady, what is your name? Loren is going to hook me up. They're going to hook me up to this transcranial magnetic stimulation. Now, I'm not really a depressed kind of guy. What else can this do for me, though?
There's different protocols that we have as depression, anxiety, neuropathic pain. There are studies for also like Parkinson's and studies showing traumatic brain injury. We've had some of those come through. But we've had good success rates with a lot of clients that come through. And by all means, we're going to demonstrate a little bit how it looks when someone sits down.
Is it painful?
It's not painful. It depends on the sensitivity of the patient. But we start very low, so for the comfort of the patient, so it's not to the point of pain. Awesome. But as a statistic or routine, you get used to feeling after a while.
I like that. And then just curious, is this covered by insurance?
Yeah.
Oh, I like it. So I can treat a lot of things. It's not very painful, and then I get to hang out with you.
Absolutely, and it's a cool room as well that we have here.
Awesome. All right, let's get going then. Hook me up. Big me up, Scotty.
We usually have a cap on the patient, but we'll do a demo for you. We have the head stopper on the right side, keep the head in place. So a little push right here. Here we go. 3, 2, 1, push.
Okay.
Before even placing the magnet, I'm going to set the protocol. And we're going to place the magnet on the left side of the cranium, which is the left dorsolateral frontal cortex. We want it to be snug, but not too tight to stop circulation. But very depends.
Does this help grow hair?
There's still studies trying to be.
Yeah.
I'm just kidding. I'm not sure.
If or not, then I would be very happy.
So I usually start very low, just to see how it feels for the person. So I'm going to start in 3 seconds, and 3, 2, 1. How do you feel this one?
It's fine.
Do you feel anything at all?
It's tickling.
Tickling? Most likely. So when it's the first session, I do start low, and then I increase little by little. So we just have that kind of comfort for the client. But there is 36 sessions in total. 30 sessions, 5 days a week, or 4 days a week, and the last 6 are Tuesdays.
How does the protocol work?
Yeah, so there are, depending on how many protocols there are, is how long the person will be sitting down. But usually we do 2 to 3 protocols now, so a good 20 to 30 minutes. The longest I've been with a client has been 45 minutes for 5 protocols. But everybody is case by case. There's people that do 1 cycle TMS, 36 sessions only, and there's some people that do it twice, depending on their case.
Yeah. Awesome. This is cool. I could totally fall asleep and you turn off the lights.
Right, it's a good ambiance of
Yeah.
So it's like a little pit stop. Okay. And then you go on your day, you can drive, work, and do everything else that you need to do. It wouldn't inhibit your daily routine.
Awesome. So no side effects, nothing for people to be worried about.
Not to that degree. The ones that we can see maybe would be maybe slight tiredness, maybe slight headache, or maybe slight dizziness, but not everybody experiences that. Maybe 1 out of 10.
Awesome.
To be honest, compared to medication, it's better to that.
I like it. Awesome. Thumbs up. Check out Pacific Pain and Wellness. Come here. You get to hang with beautiful Lauren and try out the TMS.